This patient presented with trauma to the thigh, and there was a huge swelling. And the non-contrast CT done prior shows swelling of this at the level of this muscle and hyperdense collection there. So it wasn't sure if it is a hematoma or it's an abscess. So CT with IV contrast was performed. So as we can see, there is opacification, contrast opacification of the right superficial femoral artery right here. These are the D branches. And as we go down here, there's this collection in the thigh musculature measuring approximately 5.3 centimeters. And if you look closely, there is this low density area that is the collection, and there's this diffuse swelling of the musculature. So this is likely a adductor group of muscles of the thigh. And if you pay close attention to this, there's this focal hyperdensity. The density of this focus is similar to the density of the arteries. So this is contrast that is extravasating within the muscle, and if you try to track it down, it's difficult to track and see it communicate with any branch vessel. But this is consistent with active bleeding within the muscle. So we see a trick here is this is the soft tissue window. A trick is to change the window to liver window. So this is the liver window, and you can see the collection much more better. So this is the entire muscle, and with there's diffuse thickening of the muscle, but in the central part of the muscle there is this low density area. And if we scroll down here, we can see in the dependent portion of this low density area there is this fluid level here. So this is hyperdense blood products, and this is the non-dense part of the hematoma, and there is hyperdense foci here, consistent with contrast extravasation into the collection, consistent with a hematoma within the muscle, and there is active bleeding happening at the time of the scan. So overall, these findings are consistent with intramuscular hematoma with active bleeding. Another additional finding is in the medial aspect of the thigh. I'll go back to the soft tissue window. In the medial aspect of the thigh, in the subcutaneous plane, there is this low density fluid collection. This also is likely hematoma. How you tell that is if you change window again to the liver window, you can see much better layering hyperdense material. So this is hyperdense blood within the collection. And if you look at the density here, this density is very close to the density of the contrast within the vessel. So this also is suggestive of active bleeding within this collection in the subcutaneous plane. So there's another hematoma here, which is bleeding into the subcutaneous plane, and there is active bleeding at the time of this exam. So overall, these findings are consistent with hematoma in the subcutaneous plane and intramuscular region with active bleeding at the time of acquisition of this exam. Thank you.